to the course on Introduction to Social Innovation. My name is Praewa Satutum. I'm a lecturer at the School of Global Studies at University. I teach social innovation and social entrepreneurship, and I'm also serving as project manager at Government Innovation Lab in Thailand. The objective for this online course is to understand the meaning of social innovation and identify different types of social innovation. So what is social innovation? Social innovation can be defined as a novel solution to a social problem that is more effective, efficient, sustainable, or just than existing solutions, and for which the value created accrues primarily to society as a whole rather than private individuals. So if we take a look again, social innovation comes down to something that is new, is a solution, it addresses a core problem or pain point, is more effective, efficient, and sustainable than existing solutions. Social innovation at its core has to create value, and the core part of it is that the value has to accrue to everyone, to the broader society, and not just to one individual. There are many ways to categorize social innovation. One of the ways is to categorize social innovation as product, service, process, and policy and regulations. Social innovation can be a new product, service, or a program that meets social needs. It can be a new process or a new way of doing things or approaches that help to achieve societal goals more effectively. It can be new policy, rules, and regulations, which is the creation of new laws or new entitlements that address social needs. Now let's take a look at the example of social innovation. Firstly, the product innovation. Embrace. The Embrace Infant Warmer is a low-cost product innovation designed to tackle the problem of premature death of babies in developing countries due to hypothermia. The sleeping bag keeps the baby at exactly the right temperature because inside the sleeping bag is a wax technology that's inserted into the bag pouch of the sleeping bag. This wax can be heated over boiling water. After 4 hours, the wax is removed, reheated, and reinserted. For a very low cost, a huge global problem is being addressed. Embrace Innovation has saved lives of over 300,000 babies across 22 countries. This low-cost solution is invented by a group of fourth-year students from Stanford University. For service innovation, ambulance taxi service. Many hundreds of high-risk pregnant women in an area of Tanzania around the size of Belgium are not surviving pregnancy or are losing their babies as there is no means of getting them to the hospital. In response, a pioneering new toll-free emergency line has been launched by the Vodafone Foundation alongside its NGO partners Pathfinder International and Touch Foundation and the U.S. Agency for International Development, or USAID. The emergency could help save around 225 women's and babies' lives a month, and we'll see a network of 100 taxi drivers responding to emergency calls, taking pregnant women on what is often a 3-hour journey to reach the nearest hospital. Once women arrive at the hospital, the emergency taxi drivers are paid using Vodafone's mobile payment service called M-Pesa. A trial of the taxi service late last year in a small area of Sengerima saved the lives of 323 women and babies. The next one is process innovation. Aravind Eye Hospital in India does 60% more eye surgeries than the UK National Health System at 1,000 of the cost. Efficient operation procedures and a high volume of patients enable this. The hospitals operate like assembly line with a minimum turnaround time. This ensures the surgeons to be able to carry out a significantly larger number of surgeries than is possible normally. Batches of patients would be prepared before surgery and bandaged afterwards by Aravind-trained nurses. After completed surgery, surgeons immediately move to the next operating table, where a second support team is waiting with the patient ready to be operated. This results in tremendous efficiency and cost saving. I highly recommend it you to check out the video of Aravind Eye Hospital. The last example is THICE. THICE is a private and secure online community platform centered around a person requiring care. Like an online social network, individuals, families, friends, neighbors, and care professionals use THICE to connect to each other, track and strengthen the health and well-being of a loved one, and then report back on progress. As a result of a THICE network, health, happiness, and work retention rates increase, and formal healthcare costs are reduced as people are unable to stay in their homes longer and out of the formal healthcare system. Social innovation can happen across sector. If we look at the spectrum of organizations, ranging from public organization to profit-maximizing company, social innovation can happen regardless of the organizational form. In the middle, you can see social entrepreneurship, which can be in the form of nonprofit organization, social enterprise, or social responsible business. We'll talk more about social entrepreneurship in our upcoming workshop in June. So that's it for the online learning course. We'll see each other again in the workshop in June, and we'll talk about social innovation process and also the key concept of social entrepreneurship. Thank you for your attention. See you in the next workshop.